Hi, can I come in?
Yeah.
All right, first I'm going to go ahead and wash my hands for 20 seconds per CDC guidelines. I'm going to go ahead and don some gloves. These are clean gloves. Okay. Can I have your first name, last name, and date of birth, please?
March 14, 1996.
Okay, do you have any allergies?
No allergies.
Looking at the wristband as well at the same time. Okay, at this point I'm going to go ahead and raise the bed to hip level because we're going to be doing sterile procedure today. Making sure the floor is clear from any clutters, any spills. We're clear. Looking at the, doing an environmental safety check. The bed was at the lowest possible position. Now I'm raising it. Oxygen is working. Suction is working. Ambu bag is present. Canister and Yonker is available for use. Okay, so first thing we're going to do is we're going to go ahead and talk to the patient. We're going to verify the MD order, and we're going to ensure that we have the need for procedure. So we're going to be doing a CVAD dressing change for you today, and that's going to include me changing the dressing site to prevent infection. And we're also going to be doing a blood draw, which is going to consist of me getting some of your blood, sending that over to the lab. Do you have any questions for me?
No.
Okay, no questions. So first thing we're going to do is we're going to go ahead and get all of our supplies. So we're going to get all the supplies we need for our dressing change first. Okay. So this is our trash bag. Okay. This is going to be our extra ChloraPrep. We have our sterile gloves. We have our dressing change tray kit. And then we have our biofilm and no sting barrier film. And then we also have our 2 masks. So I'm going to go ahead and place 1 mask on the patient. Okay, and go ahead and turn that direction. Put the arm up, raise this down, and then I'm also going to put 1 for myself. Okay, I placed the mask on myself. Now I'm going to go ahead and look at the site. So we're checking the site for any tenderness, any pain as I palpate right here. No pain? Okay. So no redness, no edema present, and we're good. So now we can go ahead and continue. So we're going to go ahead and remove this, like so. Make sure you hold down the middle because you don't want to pull that line, the catheter line, too far. Okay. Okay, so then now you can remove this bio patch. You can go ahead and toss this in the appropriate receptacle. And then now we're going to go ahead and look at the line. So line is the same measurement as the previous nurse. So no migration has been noted. Okay. And then now we can go ahead and continue with our dressing change. Since we're doing sterile procedure, I'm going to go ahead and raise this just a little bit more so it's more comfortable for me, but I also don't want to break sterile field. That's the biggest part. Okay, so now I'm going to go ahead and take my gloves off. Throw that in the trash. Wash my hands for 20 seconds per CDC guidelines. And then now I'm going to go ahead and begin our procedure. So now we're going to first open our dressing change tray. We're going to open that away from me. Okay. And then now we're going to go ahead and get our tray right here. We're going to go ahead and toss this. Biofilm and everything is available. First thing I'm going to do is I'm going to go ahead and open this away from me to the side. Okay, and then downwards like so. And then now I'm going to go ahead and make sure you don't cross the sterile field when you do so. Okay, now I'm going to go ahead and drop the remaining items 6 inches above. Okay, and then that's the biofilm. This is the, we don't want to drop that. This is the second ChloraPrep. We're going to drop that 6 inches from the top. Okay, and then toss the trash in there. And then now we're going to go ahead and open this. This is your no sting burial film. We're going to open that away from me, and we're going to open it as far as it possibly can. And we're going to go ahead and set this like so. Okay. Make sure you don't cross the sterile field there. I almost crossed the sterile field when I put my hand. See, if you were to put your hand like so, that you're crossing your sterile field. Make sure you position yourself where you don't cross sterile field. Okay, so now we're going to go ahead and begin our procedure. So we're going to go ahead and get our sterile gloves. Okay, you're going to go ahead and open this first. You're going to open it away from you. Okay, and then you're going to go to the side. And you're going to, yep, make sure you touch that 1-inch border, okay? And then you're going to go to the side like so. All right, now you're going to go ahead and grab your first glove, like so. This is your sterile glove. Okay, and then you're going to grab underneath here, okay? So you don't want to grab over here because you only want to grab underneath like so. This keeps the sterility of the procedure. Okay, and then you're going to go ahead and place that inside. Okay, at this point, you could go ahead and begin the cleaning of the dressing site. So first thing we're going to do is actually we're going to go ahead and reorganize this. So we're going to go ahead and move, we're going to go ahead and put this first, second, third. We're going to go ahead and make a tiny little opening right there, bio patch right there, tape right there. First thing we're going to do is we're going to go ahead and open this, open it away from the site because this does have fluid, and we can go ahead and grab our first cleansing tool. So we're going to go ahead and grab this, and then as soon as you grab this, is not sterile. This hand is not sterile. So you're going to go in circular motions for 30 seconds, making sure you don't pull on that line, and you make sure you don't touch the catheter itself, okay? And then you're going to go ahead and toss this. So I can just toss this right here. And then now you're going to go ahead and grab one of your ChloraPrep, crack that away from the sterile field since this is wet. You're going to go ahead and do in circular motions, cleaning that for 30 seconds as well in a scrubbing pattern. Okay, after circular motions have been passed, you can go ahead and toss that. And then now you're going to go ahead and grab this. You're going to go ahead and crack that now. And then now you're going to go up the line in circular motions, making sure that you don't go back down. Go all the way up, all the way up, all the way up, all the way up. Okay, and that can be more than 30 seconds. Okay, toss that. And then now you're going to want to grab your last. This is the barrier film. This is going to make sure that it actually sticks and the adhesive sticks. Okay, and you're just going to go in a square. You're going to go ahead and toss this. And then now you're going to grab your bio patch. Okay, and you're going to go ahead and place this down like so. And then what you're going to want to do is you're going to form this J. Once you form that J, you're going to go ahead and this is going to be your transparent dressing. You're going to go ahead and grab this. Okay, and then you're going to go ahead and place this downwards, like so. Okay, and once that's in there, you're not sterile anymore. So you can go ahead and grab your tape. Okay, once you have your tape, you're going to want to tape it down right about here is fine. And then you're going to go ahead and conclude that area. And then now you're going to go ahead and remove this. Okay, remove all of that. And then with this piece right here, you're going to want to make sure you place that down, and you're going to label your name, date, and initials. And then you're going to go ahead and conclude that area. You're going to clean up all the remaining items that you have. So you actually don't need any of this. So you can toss all that. And then now that concludes my dressing change, CVAD dressing change. We're going to go ahead and move to the blood draw. Do you have any questions for me? Okay, no questions. So now I'm going to get all the material that I need for the blood draw. So we have, this is going to be normal saline, okay? We just ran out. So this is going to be 2 normal saline, 10 milliliters of normal saline, and then we're going to have an empty syringe. And then we also have our alcohol swabs. We have our specimen collection bag. We have our specimen collection tubing, and then we have our needle. So first thing you're going to do is you're going to go ahead and uncap first one, okay? And you're going to get rid of any air bubbles that's inside of this flush. Once all the air bubbles are out, you're going to grab one of your alcohol prep pads. You're going to go ahead and scrub vigorously for 20 seconds. You're going to verbalize that. And then you're going to go ahead and grab this and then flush all 10. And then you're going to go ahead and withdraw all the way until you get 10. Okay, and then this is going to go into the sharps. Okay, and then once you throw that in the sharps, you're going to go ahead and grab your empty, and then since I dropped that, you're going to go ahead and remove this like so, and then you're going to go ahead and scrub vigorously for 20 seconds since I let go. You're going to go ahead and put that in there. Then you're going to want to withdraw about 5. 5 is appropriate. You're going to go ahead and get this, and then you're going to get your needle. I dropped that, okay? So make sure you guys watch that. You're going to grab your needle, okay? Apply that, and then you're going to want to go ahead and swab the tubing too, because this might not be sterile. So swab that for 20 seconds. Now place that in there. Okay, and then you're going to want to flush that all the way until you get all the blood in there. You're going to want to remove this. Safety right away. Sharps right away. You're going to label this with your name, date, initials, and then you're also going to put the patient name and then MRI number as well. Put this in the biohazard container, and then we're going to save that for later. Last step, we're going to get our last flush. We're going to get our last alcohol swab. And then we're going to get any of the remaining air bubbles out. Okay, and then we're going to go ahead and for 20 seconds vigorously, and then we're going to want to flush this in a pulsatile fashion, okay? Just the reason we do this is that we don't want any blood clots forming in this tubing right here, okay? Perfect, perfect, perfect. Okay, in a pulsatile motion, you're going to remove that. Now you're going to get one of the green caps if there is one available. Put a green cap right there. And then now you're going to go ahead and clean up your supplies. Toss everything in there. Okay, and then now that concludes the blood draw. So you are going to go ahead and send this over to the lab. You're going to verbalize that. And then you're going to go ahead and put this back on. Close, turn the bed down, put the arm down, have the patient look forward, and that concludes the CVAD blood draw. And then you were going to ask the patient, do you have any questions about the procedures that we've completed today? Okay, no questions. And then if you do have any more questions, the red call light is right there for you. And then you can go ahead and perform one last environmental safety check. Everything is working, ambu bag is present. The floor is clear from any clutters or spills. And that concludes both the CVAD dressing change and the blood draw. Thank you for watching.
We can go to Paris, or we can go to Africa. We can go see